I am Marianne Pisano, and I am here with Conversations at Triton with Dr. Richard Chan. Dr. Chan was recently voted Instructor of the Year. Congratulations.
Thank you.
On being voted Instructor of the Year. That's very exciting. So where did you grow up and go to school?
So I'm originally from Virginia. I was born and raised in Charlottesville, Virginia, and I did my undergrad at Virginia Tech, graduated in 2007, and I got my bachelor's in microbiology and immunology. I also got a second degree in sociology, focusing on crime and deviance. I also did a lot of work with social inequality as well in the program. I also got 2 minors. I really loved learning. So I got a minor in chemistry and a minor in medical humanities, focusing on patient experiences at the hospital. After I graduated, I actually did a post-bac at Virginia Commonwealth University. I did a post-bac in microbiology and immunology. I then went to medical school at Ross University School of Medicine, graduated in 2012, and then I really decided that I loved the academic environment. I loved teaching and I loved being in the classroom. And so after I graduated, I actually went back and I did a master's at Roosevelt. So I stayed in Chicago and did a master's in molecular biology and biological sciences. And that's really where I fell in love with teaching, and that's what brought me here.
So did something happen in your childhood that made you want to go into medicine? What made you originally want to be a doctor?
So interestingly enough, my very first experience of interest in medicine was actually when I was a little kid, probably kindergarten or so, first grade. We did like a career day, and one of my classmates' parents came in and they talked about medicine and science, and I loved that. And so I thought, what if this is something I could do? And then I got really interested in science, and that's kind of what led me to going in the medical route. And so I really just continued doing that all the way through, and I just fell in love with it. And I really could study it all day if I could, but I have enough student loans, so that unfortunately was not going to be a continuation, but I am so happy I got to enjoy this experience.
What kind of challenges did you run into in medical school? I'm sure it's very difficult.
Sure.
It's probably the max amount of studying anyone could possibly imagine. So what were some challenges you ran into?
Well, a lot of it really was just not having enough time to do anything. So our lives were really revolving around studying constantly. So it was pretty much 40 hours a week of just class.
Wow.
We're in class all day, labs, and then we had clinicals. So really, there was just not a lot of free time. So that was a very big shock. Just constantly studying and constantly in class. And really then when we got to the clinicals, it was just then no sleep. So we were on call a lot. There were times where I was doing 36 to 40-hour shifts and just not getting that chance to sleep. And seeing my friends and family, that was really difficult as well, just because we were just constantly busy. But it was definitely a lot of work. And it was, very difficult. It's just a lot of information, but we always like to say that it's like drinking from a fire hose. It's like how much information you can get. And at the end of the day, though, it's really a very rewarding experience. Just very exhausting.
Do you have a specific story about when you saved somebody's life or when you really helped somebody?
Well, actually, one of my favorite experiences was actually working at Cook County. I was in the trauma room.
Okay.
And so it was actually on a documentary. I was actually
Wow.
in the background for a little scene. But yeah, we did there was a patient who came in who was stabbed and was bleeding out. And we actually had to open him up, do an emergency thoracotomy, cut open his ribs and chest, and then we actually, my resident literally grabbed my hand because his heart stopped beating. So she grabbed my hand and threw it in the chest, and then I had to actually pump his heart while he was on the table because his heart stopped. And that was probably one of the most, I think, really stressful but also exhilarating experiences ever, just because it was really kind of the culmination of everything that we've learned, and it was an amazing experience. But it always sticks out in my mind because it was super, super stressful.
I'm sure you don't get squeamish anymore. I mean, does anything gross you out?
No, not really.
I
Actually,
think that really,
yeah.
I
and
can't imagine anything.
My students actually, so in the anatomy lab, we do dissections and cadaver work. I usually just hop right in like, it's no big deal, and then my students get like a little bit thrown off because they're not used to it, and I'm just like, oh yeah, it's no big deal. But yeah, you forget, how normal it is for me, I guess how normal it is for me to experience that, and then not everybody is ready for all of the gooiness and all the other things going on in the body.
Okay, so you kind of described how you got into teaching, so what led you to Triton College?
So I was actually starting off here as a adjunct instructor. I taught at night, and I was really kind of at that point, I was at the end of grad school, and I was deciding if I wanted to continue on and do a residency or if I wanted to continue going back to school. And so I was teaching here part-time during that moment while I was applying for residencies, and I fell in love with it. I taught the microbiology class, and it was life-changing, I think. It was just, for me, I felt at home and comfortable in the classroom. And looking back now, I've really realized what I love the most is the fact that it's really me talking about science and like nerding out about science and just making other people interested in science, and that's what I'm most passionate about. And so after I did my my first couple of semesters here, when it got closer to residency match, I saw that they had opened a full-time position. So I applied, and then luckily I got it, and then I ended up withdrawing from the match. And then I've been staying here since, and I've been way happy with my decision. I have nights and weekends, I get holidays.
Nice?
It's
Yes.
so much nicer. And so, yeah, I mean, I'm definitely happy with my decision. I think it was the best decision for me. I'd sometimes miss being in the full-time clinical realm, but at the same time, I think this is where I am, the most comfortable, where I feel the most, the most relaxed in the classroom.
What do you like about the Triton community?
Oh my gosh, the students here are so diverse. I grew up in Virginia, where I was really the only person of color in my entire school. There was maybe 3 families in my community that were not Caucasian. So for me, this environment has been incredibly inspiring and amazing, just because it's so nice to see all like the diversity, racial diversity, as well as age diversity too. I have a lot of students who are coming back, and those students, have really a lot of motivation. I love a lot of my non-traditional students because they help me keep my younger students in check, but then they also are really good mentors as well. And so I've gotten to really build those relationships on the full spectrum, and that's been an amazing opportunity for me.
Why do you think the students voted you Instructor of the Year? What separates you from all the other instructors here?
I think I'm unapologetically nerdy, and a lot of the students really appreciate that. I think really a lot of the times I try to teach, like a normal human being, not to be shady. It's just a lot of my former instructors growing up try to keep it very professional and very stoic.
Rigid,
yeah. And so you didn't get to see a lot of personality. And I think what I try to do is just put a little bit of my personal touch in, and just make it more interesting. And really, I kind of tell my students why I love science, why I love medicine, or why I love, microbiology especially. And it's because, what inspired me might inspire a lot of them. And, I do hear from a lot of former students who are, now pursuing similar routes, or, realizing, oh my gosh, what I learned in this class really applies to what I'm doing now. And it's really amazing to get that chance, feedback.
Do you keep in touch with your students after they leave Triton?
Oh yeah, I get a lot of student emails. I actually had a couple students, two students from two totally different classes, same semester, two different sections, who ended up at the same nurse practitioner program at Johns Hopkins. And they were both at orientation, and they were both like, we're from Chicago. And then they both turned out to be from former students of mine. And they sent me a really cute picture of the two of them, like a selfie from their orientation and saying hi. And so I get a lot of students who check back in, give me updates, and I actually occasionally have some that come back and do some presentations, to let students now know, what they're doing and how they got there, and that's also kind of a fun thing, just getting to see, there's life beyond this classroom.
That's really incredible that a whole new group of kids will be inspired by you who pursue medicine, that will be saving people's lives in the future. That's really incredible.
Yeah, and I really try to focus a lot, especially because a lot of my students are pre-health, of some form or another, healthcare. So I do a lot of work with patient education. Like I mentioned, I did my minor was in medical humanities, and so we focused a lot on the patient experience, and a lot of people have very many negative experiences in the healthcare industry and world. So it's really important that students are learning how to talk to and communicate to patients, and really making sure that they understand what's going on, and making sure that they're making the right decisions. And that's another big step that I try to infuse into my lectures.
So where do you see yourself in 5 years?
I really hope that I will still be here and teaching. I'm hopefully trying to develop some new classes. I'd love to teach more infectious disease classes. That's kind of something that I've been having minor plans in the background. I want to develop a lot of courses for students who can also use this as a springboard to other healthcare programs. And so especially with a lot of the professional programs we have available in just the Chicagoland area, we have so many schools and opportunities that I actually didn't even have when I was growing up in Virginia. We don't have many schools. So it's really nice that students have these different opportunities and options. And so I'd love to have sort of a community of programs that students can take that will prepare them for the next step.
Okay, so I'm going to ask you kind of a fun question now, because you say that you're a nerd.
Yeah.
You're a proud nerd. What else do you geek out on besides science? Do you like Harry Potter, Stranger Things? What else? What else do you like to geek out on?
So I am a giant Harry Potter nerd.
I know, me too.
I grew up with it. So for sure, I am a Ravenclaw. But nerd. So I love, Harry Potter and fantasy, sci-fi especially. I love like the Marvel, comics as well. I'm really big on kind of, the kind of supernatural as well sometimes, like, vampires and witches and those kind of things too. So those are really fun kind of interests that I have. I also play a lot of video games and board games. So those are some fun kind of nerdy things that I like to do. And then I'm also a big fan of going to a lot of concerts and live music. I've been doing that most of my life. I think it's, for me, one of my favorite outlets. I really learned over my life that it's what helps me to de-stress and just kind of appreciate life more. And so I definitely tried to, pre-COVID, go to a lot of concerts as much as I could, and festivals and things. And then now things are opening up a little bit more, so I've been to a few more. But for sure, it's definitely, going out and being around other people and just experiencing music.
Do you have a favorite band, or what are your favorite bands?
Probably one of my favorites, I think they're British DJs from, their name's Above and Beyond. So I've seen them probably at least 4 and 5 times. Their show is kind of called Group Therapy. So it's basically like this group therapy session where you're just kind of listening to this music and they kind of have these motivational thoughts. And that's actually, interestingly enough, something that I also kind of started to infuse into my classes as a segue. I actually do motivational like memes and things at the beginning of class and throughout, just because a lot of people are dealing with a lot of stress and anxiety right now, and even before, but even especially since COVID, a lot of mental health has been left on the back burner, and so just little tiny snippets in our life of self-help and motivation, that really helps a lot too. I think my students really appreciate that, just to have that thought of knowing that you just need a little bit of positive points in your life, and sometimes that can be the big game changer.
How do you think students could deal with their mental health?
Well, I think I usually tell my students, find something that makes you happy, and really, even if it's like 5, 10, 15 minutes a day, whatever it is that keeps you motivated and positive, that can be a big game changer. Because ultimately, when you're at work, when you're at school, we're super stressed out all the time, and that tiny mental break we get can make a difference. I do also actually do a lot of referrals to the counselors here on campus, so I get a lot of my students in contact with them because, again, it's a free resource, but also they have that somebody here who is trained and knows how to handle that, different types of situations. So again, that's another big one.
Okay. Is there anything else that you wanted to add that you think I missed?
I'm just super honored. I've been at Triton for actually just about 10 years now. So it has been a wild ride, but I love this school. I think I've really felt very at home here. I love my department and my coworkers, and I've really gotten to know a lot of the student population. I've actually had several students who their family members have taken my classes as well. So it's kind of fun
Wow.
seeing that kind of transition. Siblings, sometimes even parents and children have taken my classes at different points. And so it's kind of cool to have that community feel. I feel like Triton really does create this community aspect, and that really has made me feel very comfortable and at home here.
Okay, well, let me ask you one more question.
Sure.
Well, you kind of went over this already, but what do you like to do for fun?
Well, nowadays I just do a lot of TV binging.
Watching any good shows?
We just finished the Rings of Power, the Lord of the Rings on Amazon. That was a fun one. So we actually just rewatched the entire Lord of the Rings series this weekend, all 3 movies.
I
It's
never got
very
into those
long.
books. I never read them.
They're very good, but you have to have a lot of time.
Okay.
They are very long, but they're very interesting.
Okay.
So I'm big fan of those. I also love documentaries. I love science documentaries. I actually suggest a lot of them to my students too, just because not only is it relevant to the course, but they usually kind of frame them in a way that's very understandable and friendly to the public, so that students can really understand and appreciate what's going on, especially because some of the content can be very detailed and very complex, but then when they kind of create this visual that makes it very digestible for students. So I like to refer them to lots of those things outside of class and keep them interested in science, because that's really my goal, is just making sure, not that they know everything, but that they stay interested in science, that they love it and they appreciate it and really can see how it's impactful in their lives.
Okay, great. Thank you so much, Dr. Chan.
Thank you so much.